restrictive cardiomyopathy in under 10 minutes. Okay, let's move this up here. Let's draw a very simple heart. Okay, let's put up some chambers. Okay, so we're looking at the right side of the heart. We're looking at the left side of the heart. Okay, let's get the eraser. Let's see where the problem is. Let's erase these atrium. Okay, let's get a different color. So what is the problem in a restrictive cardiomyopathy? There can be a thickening of the right ventricle wall, or it could be the same size, but the problem is not so much the thickening, but how stiff that ventricle has become. And why have I erased the atriums here is usually because you get a bilateral atrial enlargement, and we'll talk more about that in the video. Okay, so let's move this out of the way, and let's get the black here. Okay, let's do definition of a restrictive cardiomyopathy. It is essentially a heart muscle disease, but it is a infiltrative. Let's put here infiltrative heart muscle disease. Infiltrative. So there's some underlying infiltrative disease process. Okay, so let's talk about some of the causes. Number one, by far, most common cause is amyloidosis. Number two, and very uncommonly asked, is sarcoidosis. And then even less commonly asked would be something like hemochromatosis. Definitely for amyloidosis, this is your number one. If they're going to ask you anything, they're going to ask you about amyloidosis associated with restrictive cardiomyopathy. Okay, so next let's look at some symptoms. Now, this disease process typically presents like a heart failure, like most cardiomyopathies, and in this case is going to present like a diastolic heart failure. And if you remember, diastolic will have an S4 on auscultation, and it may or may not be present, does not have to be present there. Okay, let's take a look at diagnosing. Definitely, if the question is asking you what's the initial test, it's going to be something very inexpensive and very non-invasive. So probably something like a chest X-ray, which you'll see bilateral atrial enlargement. Okay, and you can also do an EKG. And in EKG, you'll more than likely see a low voltage. And as far as the low voltage, you may notice it more in the inferior leads. And of course, your gold standard for any cardiomyopathy really is going to be your echo, in which case you may see a thick ventricle wall and of a bilateral atrial. I'll put E here for enlargement. Next, let's take a look at some of the treatment available for these patients. Definitely, whenever there's an underlying cause, you always want to treat the underlying cause. So, treat underlying disease. And the definitive treatment for these patients, definitive treatment is a heart transplant. Okay, let's take a look at some buzzwords. The R. Whenever I circle an R or an L, to me it represents right or left. So I like to circle the R in restrictive. So I'm always thinking about right side symptoms, right side presentation in a restrictive cardiomyopathy. Next, let's draw up a heart here. I'm going to draw just the ventricles. And I'm going to get red, and I'm going to draw the atriums like bunny ears. And I'll do a thick ventricle here. And what this helps me to remember is that it's bunny ears like a rabbit and R for rabbit. So whenever I'm thinking, what was that cardiomyopathy that caused that bilateral atrial enlargement? Oh, that's right, the rabbit ears restrictive, and there's going to be some right side ventricle involvement as well. Another buzz phrase that helps me to remember amyloidosis, specifically with restrictive cardiomyopathy. This may or may not help you. Is Amy is restricted from leaving her house at 4. Something that I kind of jotted down on the side of my notes during PA school, and it kind of always stuck with me. So it may help you. But basically, it helps me to remember that amyloidosis is the number one cause of restrictive cardiomyopathy, and there is an S4 presentation on auscultation. A 60-year-old male complains of progressive fatigue and dyspnea. On exam, his lungs are clear to auscultation bilaterally. Heart exam reveals regular rate and rhythm without S3, S4, or murmur, and extremities show 1 plus edema bilaterally. Chest x-ray reveals cardiomegaly. EKG shows low voltage. An echocardiogram shows an ejection fraction of 55% with a small, thickened right ventricle that has rapid early filling with diastolic dysfunction. Which of the following is the most likely underlying etiology of this patient's cardiomyopathy? Okay, so they are telling you that this patient does have a cardiomyopathy, as this patient really, based off of this clinical presentation, does not necessarily jump out at you that it's a cardiomyopathy, but they tell you in the question. So we know that alcoholism and myocarditis are associated with cardiomyopathies that will cause a dilation primarily of the left ventricle, not the case here. Sustained chronic hypertension will cause a thickening of the left ventricle as well, but in this case, we're looking primarily at a problem of the right ventricle causing low voltage, and the most common cause of a restrictive cardiomyopathy is amyloidosis. Thank you.